I'm not sure if anyone knows or cares, but I grew up in the beautiful country of New Zealand, and this is where I did my optometry training. As a fun fact, there's only one optometry school in the entire country, and that's offered at the University of Auckland. As a result of such limited spaces, we were lucky enough to have an extensive array of collaborations with the ophthalmology department, and as well as the forefront of vision science research. But currently, I'm practicing in Australia and it's been an absolute blast. I find it fascinating because most of the clinical side of things in optometry between Australia and New Zealand are largely the same, and that's mainly because it's governed by one body called the Optometry Council of Australia and New Zealand, also known as OCANZ. So if anyone was interested in practicing in Australia or New Zealand, you have to pass the OCANZ board exams, or attend any one of the universities that are offered between these two countries. And although the clinical side of optometry in Australia and New Zealand are the same, the politics involved are very much different. This difference is possibly due to the fact that the economy in Australia is much bigger, and therefore the public healthcare system has more resources to work with. The key difference when it comes to optometry is in Australia, most people are covered under Medicare, which is the public health insurance, no matter what age group you're in, unlike the United States where they only cover 65 and plus. In other words, the Australian government will heavily subsidise the cost of eye care for the population. So what does this even mean? Let's take a hypothetical situation where you just recently noticed your vision changing, so you want to see an optometrist. The options in Australia are quite simple. You could either go to a privately billing practice, or you could go to a bulk billing practice. Privately billing clinics will charge you fees for the consultation and you have to pay for it outright. However, depending on the amount, you could either claim the full amount or a portion of the amount through a Medicare rebate. In other words, you get your money back. But if you live in Australia for long enough, you'll come across bulk billing practices. Bulk billing practices will not charge you any money for the consultation as long as you're covered under Medicare. They might still charge you for fees that are not covered under Medicare, but most tests should be covered. And the clinic will apply for the rebate on your behalf, which means that you could turn up to a bulk billing practice with no money and still have your eyes comprehensively looked at as long as you have your Medicare card with you. If you take a moment to think about it, Australian residents are really lucky to have this system. For an optometrist to be OCANZ approved, they must pass intense board exams in both practical and theory modules. Or you could graduate one of the optometry schools in either of these countries, which take about 5 years to complete. And that's a lot of time. And for the population to have free access to these services, I think that's just incredible. Not only that, visitors from these 11 countries also have access to these services under the Reciprocal Healthcare Agreement. So I occasionally see visitors from overseas coming in for eye tests, and it brings me joy every time they tell me that the testing done here is much more thorough and comprehensive than what they're normally used to. Wait, hold on. So who's funding all of this? Where is the money coming from? The money comes from the taxpayers of Australia. It's funded by the people, for the people. Each taxpayer in Australia must pay 2% of their taxable income into what is called the Medicare Levy. The Medicare Levy is what is used to fund the public healthcare system. In addition, if your taxable income exceeds 90,000 Australian dollars, then you also have to pay what is called the Medicare Levy Surcharge, which can be waived if you have private health insurance. Private health insurance should really have a video on its own, but I'm not really sure if anyone's interested, so if you are, then let me know, I might make a video on it. I'll tell you about how that works and how it can even pay for your glasses. But getting back to public health insurance, Medicare doesn't come with its downsides, and in a way it can seem quite controversial. So let's start by talking about the positive and negative implications of the Medicare system. If you've studied epidemiology, then you'll know that the cost of treating a disease is far greater than trying to prevent it. Put simply, instead of pumping money into subsidizing an individual treatment regime for a patient with an ongoing eye condition, such as glaucoma or macular degeneration, which will probably involve the need for quite frequent visits to the ophthalmologist along with multiple tests, let alone the treatment itself, which can cost the government up to $2,000 per injection. Yikes. You could use that money to have solid foundations for primary healthcare, allowing the population to have better access to these healthcare services. which will have a higher likelihood of catching eye diseases earlier, so we don't need to get to the stage of seeing a specialist. Also, by having Medicare, it allows the population to have clearer vision, therefore increasing the overall productivity of those who need very clear vision for their work. If you had two populations, one with very good eyesight and another with terrible eyesight, then which one do you think will thrive more? Medicare also allows optometrists to control myopia better. As a teenager, myopia or short-sightedness can get worse really quickly if not intervened. So by having greater access to optometrists that can prevent this from getting worse, the future generation will be much better off. And let's not forget the most important thing of all, which is greater access to healthcare for those in low socioeconomic areas. The system does not discriminate against people without money. You still get the same service. As a clinician, the most awkward thing is when patients reject a test that I think is absolutely necessary purely because it costs money. But with Medicare, it makes life so much easier because I can get the test that I need without having that awkward conversation about how much this will cost and how much that will cost. So Medicare is pretty cool and everything, but what are some downsides? On an individual level, the biggest downside would be that 2% deduction of their taxable income. But in my personal opinion, if you see the bigger picture, I think it's better for the population, so overall, I think it is a big positive. As a result of Medicare services being so accessible, it leaves the door open for abuse. Medicare guidelines state that a full comprehensive eye test should be performed every 3 years. However, if you wanted to see an optometrist before the 3 years, then Medicare will still pay for it, although it might not be as much. Luckily, I don't see many people abusing the system, and I hope it stays this way, because I think what we have is quite special and it would almost break my heart to see it taken away from us. It's important to note that Medicare doesn't just cover eye tests, it also covers visits to your doctor, subsidies for medications, and even in some cases, eyelid surgery. So if you're an Australian resident with Medicare and you haven't had your eyes tested yet, then I would highly recommend you do so. You literally have nothing to lose. And with that being said, I'm going to end the video here. If you learned something new or at least found something useful, then yay, thumbs up to you. If you want a thumbs up back, then that would be greatly appreciated. Thank you for watching, and I'll see you in the next video.